Hello, my name is Rob Laubach, core instructor at the SOMA Institute in downtown Chicago. Today, I'm going to be demonstrating for you some beginning joint mobilizations and stretches that you can incorporate into a 60 or 90-minute wellness or deep tissue treatment. Again, these are not basically meant to be a sports massage type of technique, but it's just to incorporate some joint movements into a treatment that you would give at a spa or at a rehab center. So to start with some joint mobilizations with the client laying in the supine position, I'm going to go ahead and undrape the client. I've tucked under the waist, put the sheet in the center, face the client's head, and pull that sheet up underneath the thigh. Remember, the bony landmark is the anterior superior iliac spine, so I need to move some of that excess sheet across the body so that I do in fact undrape or uncover the ASIS. Notice that I place the sheet in my client's hand so that when I bring the leg up, the client can pull that sheet up under their hip. I'll start with just some gentle hip rotations. The idea here is that you want to push the leg more across the client's body instead of letting it come too far out to the side. You can reverse the direction of the rotation and just start to relax the area. You can use this almost kind of as an assessment as well, see how much movement the client does or does not have. It might be very restricted for the client. After an initial mobilization of the hip, if we want to stretch out the hamstrings, which are located on the posterior side of the thigh, I can place my body on top of the table and bring their hip into a flexed position, bringing the leg towards their head. If they have trouble feeling the stretch, you'll notice that I've placed my hands on the plantar surface of the foot and I'm pointing the toes towards his head as well. That will increase the stretch that the client feels. You might also want to make sure that the opposite hip, opposite thigh, is not coming off of the table. You would have to hold that down. Notice how I move fluidly from that stretch, kind of do a little bit of hip rotation before I move into the next stretch. And this is going to be for the glute muscle or gluteus maximus muscle. So I've placed the leg and the knee, I've pushed it towards the client's sternum. The stretch really depends on that lower leg being pushed towards the opposite shoulder. That is where the client will feel most of the stretch. Again, a good 20 to 30 second hold of a stretch is what will be best for the client. It'll be most effective. So this is a good stretch for the glutes. So I'm holding that knee towards the sternum and pushing the leg towards the opposite shoulder. For the adductor muscles, the adductors located on the medial side of the thigh, I've placed the leg in a figure 4 position. I've moved to the other side of the thigh. I hold down the contralateral ASIS and slowly push down on that knee. If the client does not feel this particular stretch in this position, you can actually place their foot on top of the thigh that is in the straight position so that they'll feel it more. Then, if I want to do what I call a chiral roll, I've undraped the client's arm, and I'm going to ask the client to hold on to the upper portion of the table. I secured the sheet to make sure that it's not going to come undone. Bring the leg that is still draped towards me, cross the leg, and place the foot on the table. Make my way around the table, ask the client to hold on to the top of the table, and slowly pull that entire knee and leg towards me. Now, depending on where the client might have tension or tightness in their body, some will feel this more in their hip, they might feel it more in their IT band, or they might feel it in their low back. It's a great stretch to incorporate during a treatment if you're focusing on the legs and the low back. Again, I'm going to hold that for a good 20 to 30 seconds. Slowly start to let that go up. And the reason that I'm having the client hold on to the table is it keeps that shoulder, it keeps the upper portion of the body next to the table or on the table. It really makes the stretch very effective. So I come back around, I move the leg back, pull the sheet down, keeping the sheet nice and low, cover the leg up, and then move up and take the tuck out. Now, you could do that same thing on the opposite side, but I'm going to move into some tractioning for the shoulder, for the GH joint. So what I've done is I've gently grasped the client's forearm. Their thumb is towards the ceiling at this point, and I'm just tractioning the arm down the side of their body. Again, you should not use any of your arm strength. It should just be you using your body weight to lean back. And you don't have to incorporate all of these traction techniques. You can incorporate the ones that you specifically need to use. Next, I'll bring the arm directly out to the side of the body. Notice I'm trying to keep the arm as close to the table as possible, and I'm gently grasping the forearm. If this is uncomfortable, you could always bend the forearm and put your elbow in their elbow and pull out to the side. A very good traction technique for latissimus dorsi is I brought the arm up over their head. It's important that their thumb is pointing at the floor at this point. And during that traction, I can actually bring their arm towards their face. Be a very nice stretch for that whole lateral side of the torso. Then simply bring the arm over their body. This is a very nice stretch as well. One hand is going to go underneath their scapula. You're going to hold the ASIS down and then lean back and pull that shoulder towards you. This will be a great stretch for the low back for your client. And you'll notice I'm doing this with a sheet on the client, so this is a great type of technique that you could incorporate during a full body massage. The client doesn't necessarily have to be dressed for this stretch. Very good for the low back. Slowly let that shoulder come back into place on the table. Bring the arm down. Move back around to the side of the table if that's all that you're going to do. Then pin the sheet, re-drape it, and the client will bring their arm under. Again, all of those techniques can be done on the opposite side of the body as well. So that was, again, some beginning joint mobilizations and stretches that you can incorporate into your work. For more information on these and other instructional videos, please visit soma.edu.